Hello, and welcome to our video presentation on Enhanced Recovery After Surgery, or ERAS. Today, we aim to empower you with strategies to recover from surgery as quickly and safely as possible. We hope to make this potentially daunting experience a smooth and positive one. Whether you are a patient, a healthcare provider, or a caregiver, this information will be invaluable. In this first segment of our presentation, we will discuss the remaining components of your preparations prior to surgery. Much of our clinic's work is aimed at making you as fit as possible in the weeks leading up to your surgery. This process, known as Prehab, involves optimizing your nutrition, exercise, and medical treatments. The following graph illustrates our goal, helping you have an easier recovery and maintaining your independence. As your surgery date approaches, it's crucial to prepare for what you'll need to do in the hospital to achieve the best outcomes. Depending on the type of surgery you are undergoing, you might face certain physical restrictions or be required to perform specific exercises after the operation. It's advisable to familiarize yourself with these requirements now, as post-surgery, you might feel more tired, more forgetful, or less focused. We encourage you to enter the hospital with a well-prepared game plan that you're ready to execute. This proactive approach will help ensure a smoother recovery and enhance your overall experience. Wound complications are a common setback in post-surgical recovery. To prevent issues such as infections or breakdowns, proper nutrition plays a vital role. Essential nutrients that aid in wound healing include protein, particularly L-arginine, as well as zinc, vitamin C, and copper, nutrients primarily found in lean meats and seafood. A practical approach to ensuring you receive these nutrients is to supplement your diet. For zinc, opt for a tablet that contains at least 30 milligrams. For vitamin C, tablets of 1 gram are recommended. Begin taking these supplements before your surgery and continue them while in the hospital and for several weeks afterwards to maintain optimal nutrient levels. While L-arginine supplements might be harder to find, a sufficient intake of animal protein typically provides adequate amounts of this amino acid. You can also find specialized nutritional drinks that include all these essential nutrients. However, these are generally more expensive and often contain high levels of fish oil, which many surgeons advise patients to avoid prior to surgery due to an increased risk of bleeding. Before your surgery, you'll need to follow fasting guidelines. No solid foods for at least 6 hours and no clear liquids for 2 to 3 hours before the procedure. To aid your recovery, carb loading can be beneficial as it helps keep your body in an anabolic state, which favors tissue building over breakdown. We recommend consuming 100 grams of carbohydrates the night before your surgery and 50 grams from a carbohydrate drink in the hours leading up to the surgery. While carbohydrate loading can help maintain your body in an anabolic state, its importance is not heavily emphasized due to ongoing research into its impact on surgical outcomes. It's crucial to follow your anesthetist's guidance regarding pre-surgery fasting. Often, you may be advised against consuming any liquids or solids within 6 hours prior to surgery to ensure safety under anesthesia. If your anesthetist recommends carbohydrate loading, it should be done cautiously. Opt for carbohydrate-rich liquids that are clear and flat. It's safer to sip these liquids gradually over several hours rather than consuming a large amount quickly. Ensure you complete this at least 3 hours before your scheduled surgery to accommodate any changes in the surgery timing, as the surgical team may occasionally run ahead of schedule. In the next segment of our presentation, we will explore effective strategies for managing your stay in the hospital and maximizing the benefits of your hospital admission. Early mobilization and physiotherapy are essential for recovery. Being active soon after surgery helps more than remaining in bed. We often prescribe specific exercises post-surgery to minimize complications. These exercises are gentle and can be done as much as you want, though a minimum number of sets is often recommended. Pain is a common concern among patients undergoing surgery. Many worry about how it might impede their ability to move, walk, or perform daily activities, which could affect their independence. It's important to understand that while pain is inevitable, effectively managing it is crucial for functional recovery. Once you determine the appropriate pain relief measures, your pain should become more predictable. However, if there is a significant increase in pain or a sudden need for drastically more pain relief, this could be indicative of a complication and warrants a review by a healthcare provider. In the initial hours following surgery, we encourage you to engage in light physical therapy. This helps determine the necessary level of pain relief to allow you to perform your other exercises effectively. Our goal is to manage your pain well enough so that you can complete at least 1 or 2 sets of these exercises with reasonable comfort. There are various painkillers available, each with its own side effect profile and efficacy on different types of pain. Your medical team will prioritize medications with the fewest side effects, resorting to stronger options only when necessary. Today, we'll focus particularly on opioids, which are highly effective for managing severe pain but come with a broad range of potential side effects that must be carefully managed. Opioids can be administered through different methods, including a device known as a PCA, which stands for patient-controlled analgesia. This device allows you to administer a small amount of pain medication directly into your bloodstream. Pressing a button on the PCA delivers a dose of medication. It's a direct and effective way to manage pain, though it does have some drawbacks. The device is somewhat bulky, requires an IV line, and can restrict your movement, which is why it's primarily used in hospital settings. The PCA is typically programmed to offer a dose every 5 minutes, which is how long it takes for the medication to reach maximum effect. If you're in pain and unable to move or perform exercises, you're encouraged to use the PCA, wait about 5 minutes for the medication to take effect, and then attempt your activities again. This process can be repeated as needed. If after a couple of hours the pain remains unmanageable, it's important to inform your nursing staff or anesthetist so that they can adjust your medication regimen accordingly. Alternatively, opioids are available in oral form, which can be categorized into quick-release and slow-release types. Quick-release opioids are absorbed relatively quickly by the body, achieving about 70% of their maximum effect within 30 to 45 minutes, and full effect around 60 to 90 minutes after ingestion. When using this form of pain medications, retry your exercises every 30 minutes after taking a dose. If this dose is ineffective, another one can safely be taken after 90 minutes. If 2 doses and 3 to 4 hours elapses and your pain is still not properly controlled, notifying your nurse or anesthetist is recommended so adjustments to your medication chart can be made. Slow-release opioids, on the other hand, are designed to provide a more prolonged effect. They generally reach about 70% of their peak effect approximately 90 minutes after intake, with maximum relief coming in around 4 to 6 hours. These medications may be administered on a regular schedule or as needed, depending on your specific pain management plan. Throughout your recovery, it's crucial to communicate openly with your healthcare providers about your pain levels and any side effects you're experiencing. This collaboration ensures that your pain management strategy is effective and tailored to your needs. Nausea is a common and often debilitating symptom following surgery. Many patients report that they find nausea more distressing than pain itself. Opioid medications are frequently a major contributor to nausea, although identifying the exact cause can be challenging. To manage nausea, medications are available and typically listed under the PRN, or as needed, section of your medical chart, meaning you need to request them specifically if you're experiencing symptoms. Additionally, simple adjustments can significantly reduce nausea. These include eating smaller, more frequent meals, staying hydrated by sipping fluids throughout the day, and engaging in light activities such as walking. Fresh air and personal hygiene, like taking a shower or washing your face, are also effective. Managing nausea is particularly crucial after abdominal surgery, where vomiting can increase the risks associated with bleeding, wound complications, and hernias. Constipation is another common issue after surgery, especially following procedures that involve opioid pain medications. This is particularly problematic after intra-abdominal surgeries, where straining can exacerbate bleeding, wound complications, and increase the likelihood of developing a hernia. To mitigate these risks, it's advisable to include foods high in fiber in your meals and request prune juice to keep your stools loose. Keeping well hydrated by drinking fluids throughout the day and starting laxatives early if necessary can also help maintain regular bowel movements. Maintaining proper nutrition during your hospital stay is vital for minimizing the risk of wound complications. Protein is the most critical nutrient for wound healing. We recommend prioritizing protein-rich foods in your diet over other types of food to ensure optimal recovery. A common concern among patients is how they will manage at home after their hospital stay. It is important to use your time in the hospital as a rehearsal for home life. Engage in activities you'll be performing at home, such as walking, climbing stairs, getting dressed, and managing your personal care. This practice helps build confidence that you can handle your daily routines once you're discharged. For those concerned about managing pain at home, the fear of running out of medication, or needing advice on how to taper off pain medications, rest assured that most patients manage quite well. However, for added peace of mind, we offer a pain management service. This service allows you to receive regular check-ins to ensure everything is going smoothly, provide prescriptions as needed, and offer guidance on medication management. You can easily contact this service anytime you need advice or support. As we conclude, let's discuss wound healing and the general timelines you can expect for recovery. In the first week following surgery, your wound is primarily held together by surgical materials such as stitches, staples, and dressings. These are sufficient to support your tissues during gentle movements and general mobility but are not designed to withstand strenuous activity. Wound healing progresses through the formation of scar tissue, which strengthens gradually over time. For the first 80 days or so, the scar tissue strengthens at an approximate rate of 1% per day. By 7 to 10 days post-surgery, enough scar tissue has formed to seal the skin, making the wound waterproof. By the 4 to 6 week mark, the scar tissue reaches 30 to 50% of its ultimate strength, allowing you to handle more significant stress and begin gentle strengthening exercises. Light resistance training can also be introduced at this stage to aid recovery of any injured muscles. It's important to avoid heavier stresses until about 12 weeks post-surgery when the wound has reached approximately 80% of its final strength. Complete maturation of the scar tissue and the final stages of strengthening can take up to 3 years, with tissue remodeling continuing subtly for an extended period. These timelines serve as a guide to help you understand the healing process and set realistic expectations for your recovery. That concludes our video presentation on enhancing your recovery after surgery. If you have any questions about this, or are interested in Prehab for your own upcoming surgery, please visit macprehab.com.au for more details. Like, share and subscribe for more videos like this.